Hello, I'm Cácio Lopes, Mendes, from Brazil, Pernambuco, and I will talk about metronidazole and amoxicillin association in aggressive periodontitis, systematic review, and meta-analysis. But the objective of this study of the systematic review and meta-analysis was to evaluate the effects of metronidazole and amoxicillin in combination with mechanical therapy in periodontitis for the treatment of aggressive periodontitis. In the new classification of periodontal diseases, aggressive periodontitis was classified with in periodontitis stage 3 or 4, depends the patient, or and grade C, like the patient have uh, less biofilm and lots of uh, degrees of uh, less bone in the case. This study was conducted according to the preferred reporting items for systematic reviews and meta-analysis guidelines, and was registered in the International Prospective Records of Systematic Reviews for this number. The search platforms used for this systematic review was PubMed and Medline, Web of Science, Scopus, and the Cochrane Library. Uh, this search was conducted until December 2019 and start in the middle of 2018. And the lead question talk about the patients P, with patients with aggressive periodontitis. The intervention was mechanical therapy plus metronidazole, use of metronidazole and amoxicillin in combination with the mechanical therapy. The comparison, just mechanical therapy, and the outcomes that the systematic review uh, looks like improved the clinical attachment level and reduced the probing depth. Uh, the inclusion criteria used by the conducted this systematic review was randomized clinical trials. Just it's important to more serious work. Studies with a minimal follow-up of 6 months, treatment of patients with aggressive periodontitis, and studies comparing only mechanical therapy with therapy associated with metronidazole and amoxicillin. Another antibiotics used in the others studies don't used in this systematic review. The exclusion criteria used for prospective studies without randomization, because the randomization is important and works with blind peer-reviewed retrospective studies, case reports, reviews, in vitro studies, animal studies, studies in patients with systematic disease and associated syndromes, because this kind of patients, it's not the gold pattern in the studies. Studies comparing the use of metronidazole with another therapies, like surgery therapies, like phytotherapical therapies, and etc. Studies associated with surgical therapy, studies in deciduous dentition, and letters to editors. Uh, for to do the meta-analysis, we was based on the inverse variance methods. Mean difference values were considered significant when p less than 0.05, confidence intervals for 95%, The data was analyzed using Review Manager software 5.3, and we do the kappa test to make the more signification in the study. But the results that this systematic review uh, start to searching these platforms, and we records identified through based database searching in PubMed 64, Web of Science 35, Scopus 21, Cochrane 16, and one study in a gray uh, in additional records identified through other sources. And 137 studies. When we remove the duplicate studies, 36 studies of all of them was duplicated, 101 the end. When we apply the exclusion criteria, 84 studies were excluded and screened 17. And after the read all of these studies, full of them, the 17 studies, uh, more than uh, more studies were excluded. 13 studies were excluded, and the end of the studies included in qualified synthesis, qualitative synthesis was 4 studies used in this systematic review and meta-analysis. This is the criteria used to kappa test, and the results that the hypothesis was partially rejected because the outcomes, the gain of clinical attachment level and reduce probing depth. When we read these forest plots, we can observe these forest plots about uh, clinical attachment level, and the P it's like 0.04, less than 0.05. It's not it's insignificant statistical difference when you can read this graphic. Uh, Sometimes we can observe that it's not interesting to associate uh, antibiotics like metronidazole and amoxicillin with mechanical therapy because the results are insignificant statistical difference. When we talk about the reducing of probing depth, uh, we can observe that the P 0.11, it's important because the probing depth is the most difficult thing to reduce in a periodontitis when you talk about this. When we can see the P like 0.11, it's important to use this kind of therapy to auxiliate the patients in the reduce of probing. We conclude in this study that the association of systematic antibiotics with scaling and roof planning in the treatment of the patients with aggressive periodontitis or periodontitis stage 3 or 4, grade C, in relation to the gain of the clinical attachment level, there was no statistically significant difference. But when we observe about the problem death, uh, there was a different statistic regarding the reducing of these. It's important to make up other studies or others uh, studies to conduce to directly compare these antibiotics protocols in the treatment of this periodontal disease. Uh, I'd like to thank in my schools, FAVIP Widen, UniFBV Widen, and University of Pernambuco to the make the opportunity to talk about this this study. And I'd like to invite all of them to come to Brazil, to come to Recife, to your vacations. Thank you.